Okay.
Okay. I'm just gonna talk over Sid. So I just wanted to introduce myself. I'm Emiliano, and I'm one of the co-events managers for Medical Marvels. And I'm gonna pass it off to Sid to introduce himself.
Hi there. My name is Sid. I'm sorry. I'm another co-events manager for Medical Marvels.
Hmm. All right. Yeah, so Medical Marvels is a international nonprofit organization that promotes medical literacy and awareness for all pre-health students. And so we're so grateful that a lot of you came out and registered for this event. We have an amazing guest speaker, Dr. Noble, who's going to be talking about his experiences as a physician and also taking any questions that you all may have. And so I'm going to kick it off to Dr. Noble to kick us off.
Good afternoon and good evening, everybody. My name is Stephen Noble. I'm a cardiothoracic surgeon out here in Chesapeake, Virginia. And so what that means is I'm a surgeon that pretty much operates, or a physician that operates on all diseases inside the chest, heart disease, lung cancer, diseases of the esophagus, as well as the chest wall. And so it's always a pleasure to speak to students who are at that stage of really trying to consider medicine. As I recall, being in your guys' very same shoes, really trying to figure out what it is that I want to do. And I was one that I didn't know coming up that I wanted to be a cardiothoracic surgeon. I knew early on that I wanted to be a physician, but being a CT surgeon was something that I kind of figured out along the way. And so with that being said, I put together a brief presentation really to highlight my path through medicine, how I got to where I'm at today, as well as hopefully open up the floor for any sort of dialogue. I really want this to be interactive. I found that during my path through medicine, to have the opportunity to have just open and frank discussions with physicians was something that was didn't happen too often, but when it did, really trying to take advantage of those opportunities as much as possible. And so I'd be remiss if I didn't offer that same opportunity to you guys today. So with that being said, I'm going to share my screen and we'll jump right into it. Can you all see that?
Yes.
All right, great. All right. So my path to CT surgery was one in which, this is what it looks like. So on this left of the screen, that's me doing an open heart surgery procedure, and then right there on the right, that's me with the blue gloves, sewing, doing an anastomosis, basically doing a bypass, taking vein from the leg and connecting it to the aorta and bypassing a blocked artery in the heart. And so that's one of the most common procedures that we do for coronary artery disease. It's what's called a CABG, or bypass grafting, coronary arterial bypass grafting. So how I got to that point of being a cardiothoracic surgeon all really started with my grandparents. This is the picture of graduation when I graduated from med school back in '06. On the left-hand side of my screen are my maternal grandparents, my mother's parents, and then on the right-hand side of the screen are my father's parents. None of my grandparents graduated from college. My grandmother, who was seated, she was actually an open heart surgery nurse at Oregon Health Science University back when it was in the county. My grandfather, on the left-hand side of the screen, was a merchant marine and didn't graduate high school, but was able to work his way up through the ranks of being a merchant marine. Basically, merchant marines were sailors that assisted in the transport of goods across the seas. And my grandfather, on the right-hand side of the screen, was also another merchant marine. He was a plumber. And so I joke about both my grandfathers, one being a plumber, the other one being an electrician, and how that was passed on to me from the standpoint of doing open heart surgery. Oftentimes, it can be a matter of electrical work as it relates to atrial fibrillation or irregular heartbeat. So you got to fix that electricity. And so that's the aspect of being an electrician, and then being a plumber, fixing clogged pipes, the arteries that go to our heart. Once they get clogged, you have to do some work to unclog them, whether that's putting in a stent or doing a bypass graft. And then my grandmother standing next to me, she worked in the cafeteria of the hospital up on the hill, Oregon Health Science University. So I say all that to say that I can't discuss my path in medicine without mentioning my grandparents, without mentioning my ancestors. And again, I'd be remiss if I didn't, because they were the ones that really set me on my path. And with that being said, is a picture of me on the right-hand side with my father and my brother. And, this picture highlights the carpet more so than anything else. And it was about this age that I really fell in love with the human body. My path to medicine just really started with a kid's love for really trying to figure out, why people got sick, why people developed wrinkles, why people got old and died. And it was really on the floor of my grandparents' living room, looking through an encyclopedia and flipping over the transparency pages of the skeletal system, the vascular system. And I would do that for hours. And it was really that sort of first love of just trying to figure out why the body did the things that it did that really got me interested in medicine. Growing up, I was always a big kid playing video games. And so here's a picture of some of my kids, my youngest daughter with the VR headset. And then in the top right-hand corner of the screen is my youngest son, who even at the age of 2 really liked playing the video games and putting on the headset. And so video games was a big aspect of my life growing up. My parents didn't like us playing video games. My father always said, I would never amount to much playing video games as much time as I did. But video games served as a means, as a carrot, because it really forced my brother and I to really get our homework done, to do well in school, and to do anything that we could to use any extra money that we had to buy video games. And so that is something that has always been with me growing up. Fast forward into high school. High school was an interesting time in life. Again, I knew I wanted to be in medicine. It was a tough time because I had to be focused, and I knew that the path that I was going on, I really couldn't do certain things or be involved in certain things because I had to be focused on my GPA. And so this is one of my favorite pictures from high school, dissecting a cat in a biology class. And fortunately, I was paired up with 3 lovely ladies that wanted no parts of the cat in dissecting the cat, so they allowed me to do it. And that was really my first sort of foray into really use my hands in doing anything surgically related. And I really didn't know it then. I really didn't have an inkling of going into surgery, but I just really loved dissecting the cat, just the fine, delicate nature of trying to make the cat look nice and dissect all the different body parts. That was probably the first time that I really thought about, potentially doing something with my hands or going into surgery. After college, or excuse me, after high school, I graduated in high school in '96 from Toledo, Ohio, and then I went to college down at Xavier University in New Orleans, Louisiana, historically Black college university and the only Catholic one. And in college, I enjoyed my time. I knew that, I wanted to go to medicine, and I chose Xavier because it was #1 in putting Blacks into medicine. So it just seemed like the natural sort of way of things to go to Xavier. To go down to New Orleans and go to that university. There, I met a lot of great people, and it's amazing the individuals that I met during my time, my 4 years at Xavier, that really changed and really reinforced my path in medicine. And one of the biggest things that my time at Xavier really taught me was the power of positive peer influences, having that core group of people around you to hold you accountable, to push you to greater heights, into individuals that you can lean on for a sense of support, as well as when the days get dark, who can you turn to really give you some guidance and assistance. And I can remember in college, my sophomore year, organic chemistry is just that class that just weeds people out. It's one of those classes that separates, those of us that go on to medicine and those of us that don't, because of organic chemistry can be devastating of a class. And had it not been for my friends and other people that were in the struggle with me, I don't know if I would have been able to make it through being able to pull those all-nighters and really be in the mud with other individuals. But we made it through, and it was really, again, the power of positive peer influences. So after Xavier, because I spent so much time, because I had such a good time at Xavier in New Orleans, again, it's New Orleans, so college can be a great time, but if you party too hard, that may be reflected in your grades. And because of that, I ended up going to grad school. And so I ended up going to grad school at Indiana University. And that was really one of the biggest first setbacks that I had in my career, or had in my life. Growing up, I had good grades. I always, worked hard and was able to really meet success. But not getting into med school, the first go around was very tough, and it was probably the very first sort of major setback that I had in my life, in my career. That major setback really forced me to really evaluate and assess some things. And first and foremost, it was my test taking abilities, and really having to come to terms with, some of my strengths as well as my weaknesses. And one weakness that I had to really address was just test taking ability. And I had to realize that what oftentimes when people are told, oh, it's only going to take you about 2 to 3 hours to study for this sort of material, I quickly realized that for me, it was going to have to take, twice that, or maybe 3 times that. And so with that being said, that year in grad school really helped me focus on several things. One, getting my GPA up, and 2, really addressing some of the deficiencies that I had, both in my application, but more specifically with test taking. And medicine is one of those fields in which you got to take a lot of tests. You got to take an MCAT, that medical entrance exam. And then when it comes time to graduate med school, you have to take a host of standardized tests. And then for your respective discipline, whether you're going to medicine or surgery, you have what are called board exams to become board certified. So taking tests is a natural part of the career progression of anyone in medicine. And so having to face that early on in my career, of really coming face to face and look at myself in the mirror as to really figuring out test taking strategies was key. And it was this opportunity at Indiana University, working with these other individuals, that again, I was able to meet success. And another example of, again, the power of positive peer influences. And if you look in the right hand, the lower right hand picture, the individual that's kneeling down is actually our former Surgeon General, Jerome Adams. And so he went to med school with us at Indiana University. And so really a great time. And these individuals that I met are great professionals, but individuals that mean a lot to me, because they were there with, we were all together in that struggle of trying to get into med school. Fast forward, after my time at Indiana University, I then ended up going to Oregon Health Science University for my general surgery residency. It was during med school in 2001 that that 9/11 happened, and during after 9/11 happens, my first year in med school, and I ended up taking the health professions scholarship program. So I took the HBSB scholarship and ended up joining the Navy. However, the Navy decided that the quickest way for me to become a trauma surgeon and deploy would be to do a civilian residency. So after med school, I did 5 years of what's called residency, specialized training in general surgery in Portland, Oregon. And then after that time, I ended up going to doing 2 years as a general surgeon in the Navy in 29 Palms. Also, during my residency in 2008, I got married. And so that just goes to show that life doesn't stop. Through this course of through my path of medicine, other people are out there enjoying life, getting married, having kids, and so you got to find time to kind of do those things. And so it can be difficult, definitely more difficult for my female colleagues than it is for us guys, as far as doing some doing those other things that that some of our colleagues that aren't in medicine get to partake in and participate in. But this picture really highlights, you know, my marriage and my family is what grounds me. And, you know, without them, I wouldn't be where I'm at today. And so it's definitely a source of support and a foundation as it relates to my path to success, or at least my career. So after residency, I spent 2 years as a general surgeon in 29 Palms, California. I couldn't go straight through to fellowship, but then after my 2 years in California, I did what's called a cardiothoracic surgery fellowship. And so basically what that means is I did 2 years of specialized training in heart and lung surgery. And so day in and day out, that's all we did was heart and lung surgery. And for 2 years, every operation that I did was really related to diseases within inside the chest. The operation that you see us doing on the right-hand side of the screen is us doing a lung transplant, a bilateral lung transplant. And because I was at an academic center where most of these programs are, our program was one that was involved in transplantation. So whether that was heart transplants or lung transplants, that was something that we as quote unquote fellows, that's what we did, was participate in transplantation. Another thing that I got to do was robotic surgery. And during that time of my 2-year training at the Ohio State, I got specialized training in robotic-assisted thoracic surgery. And this is something that I do on a regular basis. Robotic-assisted thoracic surgery, or minimally invasive robotic surgery, is a great way to perform surgery, especially as it relates to lung cancer surgery. And this is not me, this is my youngest son sitting on the console. And this is, you know, him when he was 12, the same boy that had the headset on. And as you can see, he took to that console like a fish to water. And during my time at Oregon, during my residency, I participated in a study that looked at those surgical trainees, those residents like myself that had a history of playing video games. How quickly were they able to pick up skills of laparoscopic surgery or minimally invasive surgery in comparison to those residents or trainees that had no experience with video games? The study showed that those of us that had video game experience picked up surgical skills a little bit quicker than those of us that didn't. However, those of us that didn't have growing up playing video games were able to overcome that lag with practice. So it goes back to that Malcolm Gladwell 10,000 hours, that you can become a master or great at anything if you put in those 10,000 hours. Kids put in 10,000 hours playing video games, so naturally, if you put them on a robotic surgery console, they're just going to take to it like a fish to water. And so, with that being said, I always tease my father on his statement about me not amounting to much because I play video games, because this is what I do almost each and every day. And so my time in the military was a great one. I spent 7 years of active duty service in the military with the Navy. 6 months I deployed to Afghanistan, and that was a dream come true from the standpoint of being a surgeon and really wanting to be deployed and have that experience of battlefield medicine. And so my time there in Kandahar, Afghanistan was definitely something that I look back at fondly now, but when I was over there, I wasn't thinking too fondly about it. So as it relates to what I do now, I'm a cardiothoracic surgeon here at Chesapeake Regional Healthcare in Chesapeake, Virginia, medical director of the lung nodule screening program, where we look to diagnose lung cancer as early as possible. With that, when you're able to diagnose and stage lung cancer as early as possible, you're able to treat it with small or minimally invasive techniques, small incisions, and the opportunity to get patients home as quickly as possible. I'm a big fan of video games, but I'm also a big fan of movies, and Black Panther is one of my favorite movies. One of my favorite characters in Black Panther is Shuri. I think she's the coolest thing ever, in particular because of the technology and what she's able to do in her lab. It is like what we do in the operating room each and every day. And so one of my favorite scenes in Black Panther, the first one, was in regards to her Zen table, in which she was able to remotely control T'Challa's or Black Panther's car through this almost virtual reality sort of telesurgery, if you will. Well, if you fast forward to another love of my life, again, video games. So I am a big fan of video games. I play Apex Legends, one of my favorite video games. I also play 2K. I don't play Fortnite. I enjoy watching kids play Fortnite, but I myself cannot play Fortnite. It's too complicated, all the building and whatnot. But I think it's a great way to get kids involved. And so with that being said, that leads me to the discussion of how does Black Panther, video games, and all this stuff sort of come together in what I do on a day-to-day basis. And so this is a CT scan right now, right now what you're looking at is a scan. On the left-hand side of the screen is a non-contrast CT scan, a chest CT, basically a picture through someone's chest. And what you can see on the left-hand side of the screen is a circle or a nodule. CT scans are situated such that what's on the left is actually the right and vice versa. And so when you're looking at the right-hand side of the screen, that same circle or nodule is now lights up. This is what's called a PET scan. And a PET scan is a special sort of CT scan in which sugar is given into an IV, and those things that take up that sugar or that appear to be very orange or hot signify that it could either be something that's inflammatory or inflammation, something that could be infectious, or something that could be cancer. And in this situation, we are concerned that this could be cancer. And so for this gentleman, the question was, should we biopsy it first, meaning should we stick a needle into his chest and get a diagnosis, get some tissue to figure out what this is, or should we just take him straight to surgery? Well, we elected to take him straight to surgery. And this slide really just highlights how one of the more technologically advanced procedures is to be able to do a single anesthetic event procedure, meaning put a patient to sleep at one time, and using a robotic-assisted bronchoscopy procedure, you can diagnose that nodule and then at the same time be able to take it out, all while the patient is asleep, all in one day. So here is a picture of me at a conference playing with the controller of one of those robotic-assisted bronchoscopic devices. And what you can see about this controller is that this controller is basically a retrofitted Xbox controller. And so using a retrofitted Xbox controller, this company called Monarch allows surgeons and physicians to be able to take a needle down through the airway of someone's lungs and be able to biopsy it using a controller that's essentially like playing a video game. Here is a picture of what it looks like in the operating room when we're getting ready to do one of these single anesthetic navigational procedures. On the left-hand side of the screen, you can see that there's just a lot of equipment. We do this in one of the largest rooms in the hospital. And then on the right-hand side of the screen, you see my colleague, Dr. Ahmad, who's an interventional pulmonologist. So he's a lung doctor that specializes in lung diseases, but he also does interventions, meaning he does therapies using a scope and small instruments. So what he's doing right now is he's doing a navigational bronchoscopy. And basically, if you recall that nodule that we saw in the beginning, what he's trying to do is he's trying to biopsy it, but also he's trying to leave a marker, some breadcrumbs, such that when we do the surgery, I can know exactly where that nodule is. Here's a picture of just more equipment in the operating room. there on the far left-hand side of the screen is just a robot. It's docked. That plastic that's over there is just sterile equipment to keep it sterile. And then the middle picture just shows what the operating room looks like. And then on the far right-hand side of the screen, those are the two consoles. And what you can see there is that there's two consoles side by side. So when you're learning on how to do robotic-assisted surgery, we have the opportunity such that you can have a pilot co-pilot sort of situation. And so when I was in training, when you had these two consoles together, one, the attending surgeon or the instructor could be on the left-hand side, whereas the co-pilot or the junior surgeon could be on the right-hand side. And by doing that, you can break up the case or break up the surgery in such that the more complex parts of the surgery are done by the more senior surgeon, and some of the easier parts are done by the junior surgeon. But this is just what it looks like. And again, you can see the correlation to the airline industry and other industries in which you have a pilot co-pilot sort of situation. This is a video that just basically highlights what it looks like to do that navigational bronchoscopy. And essentially, it's like using Waze or Verizon Navigator to kind of get down to that area. That green dot is that nodule that we're trying to biopsy. You can see that purple line that's basically telling Dr. Ahmad, this is where you need to go inside the airway. And so once Dr. Ahmad does the biopsies, he'll also put in what are called fiducials, some markers that basically serve as a means to confirm that we got what we necessarily wanted to get out, in particular cancer or the nodule. After we do that sort of procedure, the navigational bronchoscopy, we then get to put a special tube in their throat so that we give air to the left side of their lungs, none to the right side, and then we get the patient up on their right side with the right side up, and I make some marks on their chest to plan where I'm going to put my incisions, and this is what that looks like. After we get the patient all prepped and draped, so prepping, we got to put, we scrub the body with a special sort of antiseptic to kill all the bacteria. Then we put all these drapes down, and then we put in what are called ports. The ports are like small tubes that allow us to put instruments inside the chest. And so what you can see here are 4 ports that are put inside the chest. You see a tube coming out of one of those ports. And what goes into that tube is air. So air gets insufflated inside the chest so that we can push the lung down and create more space inside the chest. Now, the chest is a box, and you can't make the box bigger by blowing air inside the chest to make it expand. Unlike the belly, in which you can do that and the belly will get bigger, the chest is not going to do that. So what we do is we insufflate air to kind of push the lungs down so that the lungs stay out of our way as much as possible. You don't want to put too much air into the chest, because then you can cause some issues for the heart, and the heart's not going to like that, and the patient can struggle and have a heart attack, and that'll make your day a bad day in that sort of situation. So after we put the tubes inside the chest, the ports, we then connect or dock the robot. So Da Vinci Xi is the manufacturer of the robot. And so Da Vinci is like saying PlayStation. There's only one manufacturer in the United States that we really use for robotic surgery, and that's Da Vinci, AKA it's kind of like the PlayStation of our of surgical equipment. Now the Xi is the different versions of the Da Vinci robot. So the Xi is kind of like the PlayStation 4. Or I like to call it the PlayStation 3. The reason why I call it the PlayStation 3 is because it doesn't have what we call haptic feedback, meaning when I'm using the robotic instruments and I hit something hard, I can't feel that in the controller. Unlike when you're playing PlayStation, Xbox, and you tackle someone, if you're playing Madden, you can feel that in the rumble stick. You can't do that with the robot. And the reason why that's important is because you don't want to inadvertently put a hole in the heart or put a hole in the lung because you didn't, you thought that, oh, this was a hard structure or it was bony or something of that nature. So to this point, technology hasn't been advanced enough for us to really get a sense of feeling when we're using the robot. And so we have to use other clues. And that's why we have to perform the operation in a particular manner in which we do. So again, this is just my son sitting at the console. This is what it looks like when you sit at the console. This video here just kind of demonstrates what it looks like when the surgeon is controlling the robot. Those are the hands. He's, as you can see, him moving his hands. And then in the other picture, now you can start to see the robot move, and that's what it looks like moving on the outside of the body. So these are pictures of what it looks like on the inside of the body. And again, the reason why I show this picture here is, as you can see, that blueness, that blue dye, that was put into the chest by Dr. Ahmad, and those are the breadcrumbs. And so, as you can see, that instrument at the 3 o'clock position, I'm controlling that instrument with my right hand. But if I touch that blue portion of the lung, I won't be able to feel if that's hard or soft, representative of a mass, a tumor, or cancer. And so using this blue dye and doing that navigational bronchoscopy, now I know all I got to do is just cut out the blue stuff. Take a stapler and just cut out the blue stuff. This is just a picture kind of sped up of what it looks like to do robotic surgery. I'm just really trying to put that specimen into the bag. Basically, you know, playing basketball, if you will, just trying to dunk it into that bag. We did a procedure in which we cut off the top portion of that person's lung because it had cancer. And now we're taking that specimen out and some of the other things that we were using to do the surgery. This is another picture of it sped up of me doing an operation. This is me using a robotic stapler to staple the blood vessels that go to the lung that are coming away from the heart. This is, again, me controlling the robotic instruments to remove some both blood vessels as well as lymph nodes to really see if to see what kind of cancer this patient has and if anything else needs to be done. And this is me just getting ready to remove the bronchus, the airway that goes to that lung up there. And after I staple it, it's now free, and then I'm able to put it in the bag and get it out of the chest. It's more of the same. And again, this is just more pictures of, let me see. Sorry. And this is a picture of that patient that had the surgery. So she had the surgery in which she had the top portion of her lung removed. It was early stage lung cancer. And she was able to go home after 2 days in the hospital and get back to work after 2 weeks. She's a hairstylist. And so being able to have this robotic assisted surgery was a means for her to get back to work and do the things that she enjoys to do. In addition to doing robotic assisted surgery, inspiring the next generation of surgeons, of physicians, is what I love to do as well. And to that end, I wrote a children's story, The Heart of the Hero, the story of Dr. Daniel Hale Williams. And Dr. Daniel Hale Williams is credited as performing the first successful open heart surgery, but his most important contribution to medicine is starting the first interracial hospital in the United States. And so it is on the back of this giant that we all do what it is that we do, both in medicine as it relates to open heart surgery, but more specifically how we deliver care in America, and that is at hospitals in which both Black folks and white folks and anybody can really get the care that they need and deserve. And so that children's book I wrote to both tell that story, but also inspire children to pursue and chase their dreams. And again, one of the sayings that we do not inherit the earth from our ancestors, we borrow it from our children. And my path in medicine, I'd be remiss if I didn't talk about the importance of being able to give back to the next generation. I've had a countless number of mentors and individuals along my way that just really kind of showed me what it was like to be a doctor, that showed me, that took me underneath their wings to kind of show me what needed to be done and how to do it. And therefore, I think it's only right and fitting that with given the opportunity to do that, that we reach back and teach the younger generation the craft, because without them, we're doomed. They are going to be our future physicians, and therefore it's incumbent upon us to make sure that they're squared away. And one of the great sayings from Dr. Daniel Hale Williams is that anything is possible when it's done in love, and everything you can do should be done in love or it will fail. And so with that, let us go out and accomplish the possible in love. And that's what we do in cardiothoracic surgery each and every day. The reason why I think that CT surgery is the best field in medicine is because we make the impossible possible. And that has to be done with love, and to really take someone to put them on the heart-lung machine in which you stop their heart, and then you do some bypasses, and then you reanimate their heart, and you see that heart start to beat again. It's one of the greatest things, in life, next to seeing my children born. And so when you see that, to be a part of that, it's a truly amazing thing. And with that, I'd be remiss again not to mention Dr. Danny Hill's words as far as doing the possible in love. And this is why I do what I do. For me, it's not about the awards, not about the accolades, it's about the patients. And this is really what, going from being that little kid on my grandparents' living room floor to being an individual that each and every day is living a dream truly. These patients are the reason why, I get up and do the work. And I'm not a morning person. Every day I hate my life because I'm not a morning person. Unfortunately, surgery is one of those things that you just got to get up in the morning to do. Surgeries typically start at 7:30 in the morning. So with that being said, you can already do the math as to what time you got to get up. Sometimes I got to be up at 4:30, 5 o'clock. And so I say all that to say, I hate the fact that surgery is one of those things that is done in the morning. However, with all that being said, I love my patients, and these are all patients that I had the fortune and opportunity to treat in 2022. And those photos that you see in black and white, those are photos of patients that are no longer with us. And one of the hardest things in medicine is loss. Losing patients. And I think that as I was coming up in medicine, I had a rule that I'd only, shed a tear once for patients or anything, healthcare related. As of recently, and because of COVID, I had to get rid of that rule, because you realize that there are some days in which, patients, you got to break that rule of just one tear a day or one moment, because sometimes it can be that difficult, that tough. These are the people that you get close to. These are people that share moments of their life that they want to share with anyone else. And as a cardiothoracic surgeon, I admit that I see people at their worst. And I tell folks, for you to see me, something bad has had to happen in your life. People don't see me, on a good day. If you're seeing a cardiothoracic surgeon, something dramatically wrong has happened in your life that you need open heart surgery. And with that being said, there's a closeness or a bond that exists between a patient and their physician, and I cherish that relationship. And my patients are near and dear to my heart. And one of my favorite photos or favorite things to do is to take this post-operative photo. The photo that these are patients that they had their surgery, and things went as well as could be expected, enough to be able to crack a smile and sharing the blessing that that we're living to see another day. And so this is definitely one of my highlights of my career, is all the patients that I've been able to treat over my career. And with that, my path to cardiothoracic surgery, just want to leave you with some few words. First and foremost, the vision. You got to dare to dream big. Don't let individuals, the naysayers, say you can't do it. I've had many of those individuals that say that, oh, you're not going to go into surgery, or you're not going to do this, you're not going to do that. And I didn't come into medicine thinking I was going to do surgery. I initially thought I was going to do med peds. Then I thought I was going to do psychiatry. I thought about doing ER for a little bit. But it was during my general surgery rotation, I was about to scrub in. I was washing hands at the sink. and I was a third year medical student. And it was about this time that as med students, you're starting to having to decide what you want to go into. And I'm about to do scrub in on a kidney transplant case. And I'm at the sink washing my hands with the fellow, the surgery person that's doing their specialized training in transplant medicine. And he asked me, what did I think I was going into? Excuse me. And I said that I'm leaning towards doing surgery. And he said, you're not going to do surgery. You either know it or you don't. And that, I was offended by that because that was my honest answer. I was leaning towards surgery. I didn't know if I was going to do it or not. I liked a lot of things, but because he said I couldn't do it or that I wasn't going to do it, I made my decision right then and there that I was going to go into surgery just because that dude said no. And that was kind of, that set me on my path, and I haven't looked back. And I've enjoyed, every moment of it. Yes, it can be hard and difficult, but it's that vision of knowing what you want to do and dream big. The second thing is passion. You got to remember that passion, that fire that you have. And for me, it was always about remembering who that little kid was on that living room floor when life gets tough, when your friends are out there kicking it, having fun, doing all the things that you want to do when you don't want to study an extra hour or put in that time, that work, that energy. You got to remember that passion. First, you got to find out what you love to do and then figure out how to make a living doing it. And I was blessed and fortunate to know at an early age that medicine was something that I wanted to do. And it's that passion and that fire, that drive that keeps me going. Community. It takes a village. And again, the power of positive peer influences, the power of, groups like this, Medical Marvels, to be able to come together with other like-minded individuals to really figure out, the pitfalls, how to avoid the potholes in the journey, and to really lean on each other and push each other to higher heights. It really does take a village to get someone through medicine. Mental health is key. And mental health is an all-encompassing sort of term or phrase here. One of the biggest things about mental health is planning. I think it's very important to plan. I had a plan for everything, and I wrote that plan out. And so, I had a plan of where I would be, 5 years from now, 10 years from now, even, doing it on a granular level. What my day is going to be like, what the next week is going to be like, the next month, the next 3 months, 6 months, so on and so forth. And I had that plan, and I do that even to this day, looking 3 to 5 years out, 10 years out, because it's very something that for me, that makes me feel comfortable. That is part of my mental health. When I don't have a plan, I feel scattered, I feel lost, and I feel like I'm just spinning my wheels. And so planning is very key to keep me focused and to keep me on the path. It's also important to reflect. As I mentioned, not getting into med school right out the gate, I had to reflect. I had to really do some introspection and to figure out why. I had to look at the man in the mirror and say, I just wasn't up to par, and figure out what are those things that I need to do. Journaling and introspection is something I find very useful. I journal for a variety of reasons, but I find it useful to kind of see the growth and progression over time. Meditation is key. Again, just trying to find those moments. And oftentimes the meditation is just really about trying to center myself and plan the next day, what am I going to do today? And really make sure that I'm not missing out on anything, and really have that quiet time, that peace. And then counseling is very key. I think the stress of medicine is there, especially the stress of surgery and the stress of CT surgery. During my career, during this year, suffering tragedy is key. My family suffered the loss of our youngest son. The picture of Savan, the one that you saw with the headset, the one that was sitting at the robotic console, he passed away, midway through this year, and even now, trying to process that, trying to get through that as a family, but also as a surgeon, as a physician, is tough. And one of the most humbling and difficult things was to be vulnerable, both with not only with myself, but with my patients, as well as with my colleagues to let them know when I was and wasn't okay. And you know, you got to learn, you got to know yourself, know when you're right, when things are good and when you're not. And there were times in which I did have to take a step back from my career to say that, you know, I'm not in the headspace to really operate. And during that tragedy, I had to reach out to other individuals that have kind of been in that same path. I had to reach out to a colleague of mine who lost his wife during fellowship, during his training of being a heart surgeon, to really figure out for him, when dealing with tragedy, when dealing with grief, how do you get back up on the horse to operate? And in medicine, and especially CT surgery, we, you know, try to, you know, look at ourselves as a tip of the spear, the best of the best. And oftentimes being vulnerable is one of the most difficult things for us to do. But I'm blessed and fortunate enough to say that I have colleagues and a staff that have stuck by me, an organization that has really supported me. And I think it's key because the mental health toll that this career impact can take is real. And being able to have some sort of idea on how to balance and manage that is key. Physical health is important. You know, exercise is key. I can't stress it enough. It's difficult. It's tough. You know, I don't get to the gym as much as I like to, or much as I want to or need to, but I do find that working out just physically definitely makes things better and puts me in the right sort of mental space. I often go to the gym with the mindset of, you know, I got some mental things to work out, and I'm just going to mentally work it out physically, and really put my body through some of that rigor. And last but not least is humility. And that comes from my faith, my family, and my patients. And that's, you know, one of the key things in CT surgery is not to get a God complex, or to, you know, think you're more, you know, that you're more than what you actually are. At the end of the day, you know, I put on my pants just like any other person. At the end of the day, the greatest thing that I've done in life is to be a father to my children, and the greatest blessing that I have is my family. I'm blessed to do some great things, and have been given God-given ability and talent to help people in some bad situations. But the humility aspect, as quickly as it's been given, the quickly it can be taken away. You know, I've seen colleagues get involved in tragic accidents to the point that, you know, their career is no longer the same. What I do, I'm a cardiothoracic surgeon. That does not define who I am. You know, what defines me are my, you know, is my faith, my family, and my patients, the works that I do. And so with that, humility is key, to be able to keep that common touch with patients. That's going to be the thing that really sets each of you guys apart from other individuals, that connection, that empathy, that compassion, because that's what, you know, sooner or later we're going to be able to train, you know, robots to be able to do a lot of the things that we're doing. But that empathy and compassion, there's no amount of, you know, machine learning that you could do to really be able to tell a patient hard or bad news in an empathetic way, to be able to hold their hand, to give them a hug, to not say anything, but just to give them a hug. And so it's that humility to never to feel as if, you know, you are just as human as that patient that you're treating. And so with that, I give my patients a hug. You know, I cry with them, I laugh with them, and it is definitely a blessing and a joy to do that. And so with that, that is all I have. Those are the 5 great ones. And again, I thank you guys for your time, for spending a Sunday afternoon or evening with me. And if you guys have any questions, please feel free to ask anything and everything. There's nothing off the table or too crazy to ask. So I'll stop sharing.
Thank you, Dr. Noble. That presentation was awesome. I think we've all learned a lot from that. And just like he said, if there's any questions at all, please don't be afraid to drop them in the chat. Personally, I did see a couple that came in before the presentation that were submitted on the Eventbrite. Emiliana, if you could go ahead, just put them in the chat to get us started. We could probably answer those first.
Yeah.
And in the chat, I also put my email address. So if you guys please feel free to reach out. And then there's a link to the book that has a website in which you guys can reach out to me as well.
Yeah, and also just before like I put those questions in, I would just like to say like that was like the best presentation that I've ever seen, honestly. Like that was so amazing and so inspiring. Um, it was just like it's so warming to me to see how empathetic you are to like your patients and like how you treat your patients and basically other humans and like it honestly almost it makes me so emotional because I kind of emphasize that same kind of aspect in my life of being empathetic towards people, and I really appreciate that. And so I just want to thank you for presenting and being here and showing your talents to everybody.
My pleasure. You know, that Miliana, you bring up a great point. And you know, it brings up the point as far as what people tell me all the time. And, you know, after a while, I understand what they mean from the standpoint of you just don't strike me as you know, your typical surgeon or CT surgeon or just physician. And I think the key aspect or the key teaching that I want to give all you guys is try not to lose yourself, you know, through this process. You know, try not to forget, you know, who you are as you go through and hold on to that humanity. There's going to be times in which it gets beat out of you because of, you know, just the rigors of the job, and you get into it thinking in one thing, and then you get into medicine, you realize, oh, it's not what I thought it was. As far as the business of medicine, this is a business. You know, this is a business. It's an art. It truly is an art, and it's one of the greatest sort of art forms, you know, in all of society. But in America, it's a business. But although it's a business, it's still an art. And what is needed more so than anything else is the compassion and the empathy from everybody. And so with that, bring your full self, you know, as difficult as it may be from time to time, to who you are as a physician. Patients are going to enjoy it. And I realize that oftentimes we put our own sort of limitations on who we can be, but patients just care about, you know, who's going to treat them the best way. And so I've rocked my hair from the high-end type when I was in the Navy to, you know, wearing dreadlocks, you know, both as a medical student, as a resident, and now growing my locks back out for the, you know, for the past 4 years. And patients can care less, you know, about my hair. What they really care about is he going to treat me the way that I want to be treated? And I've had 2 family members, both my mother and my aunt, get treated with lung cancer. And I can honestly tell my patients, I'm treating you the same way that I would treat my own family members. And I've had to tell my aunts, my mother's mother, that she needs radiation therapy, that she's not a surgical candidate. And then my own mother, she just had the same surgery that I showed you guys earlier this evening. She had it by one of my colleagues 2 weeks ago, and she's doing great. So, Emilion, you're definitely right to be able to bring your full self to who you are as a physician, and don't lose that.
Thank you. And so I'm just going to put the first question in the chat, and I'm just going to read it aloud. How do you approach discussing complex medical conditions and treatment options with patients and their families, ensuring they understand the risks and benefits?
That's a great question. So when I said it takes a community, a village, you know, I wholeheartedly mean that. And so one of the first things that I do is I talk to my staff, and I prepare my staff that when patients come to see me, it's going to take a little bit longer than what you may have been used to in other offices. And with that being said, you know, we need to express that to the patients in the waiting room, that Dr. Noble may be running a little bit late because, or a little bit over, because he's trying to give, you know, his undivided attention to the patient that's with them. Because I say all that to say a visit with me may take about an hour, you know, and because I'm going to sit up here and I'm going to draw pictures. I'm going to draw the same pictures I draw for everybody. I'm going to draw the lungs, and I'm going to show the right upper lobe, the right middle lobe, and the right lower lobe. And then I'm going to show the left lung, the left upper lobe, and the left lower lobe. And I'm going to explain it to them like they're, you know, like they're my 3rd grader. And, you know, because I really need them to know in painstaking detail what we're about to go through, what they're about to go through. They're about to, you know, undergo some sort of procedure in which there could be at least a 2% risk of having a heart attack, stroke, or dying. We're talking about heart and death. We're talking about life and death type surgery. So when they sign that consent form, I need for them to truly understand what this is like. So with that being said, I draw pictures. I explain it in a way in which, it's easy for them to understand. And then I give them that picture. So when they leave my office, they have a hand-drawn picture of what their diagnosis is in layman's terms. So when they leave, they have a sign drawn saying that, that I have a pulmonary nodule. Well, what does that mean? Well, I have a lung ditzel. And then I draw what the plan is going to be. They're going to have to get some CT scans. We're going to take them to surgery. And then we're going to talk in detail about what that surgery is going to be. There's going to be a 2% risk of having a heart attack, stroke, or dying. That risk may be, higher or lower depending upon some of other risk factors. And then we discuss the alternatives. And so at the end of the day, patients leave my office with a better understanding of what they had. And oftentimes what they tell us, tell me and my staff, no one has ever explained, my situation to me like that. That's a blessing and a curse. The blessing is that you feel good that patients understand what's going on. The curse is that now, patients are coming to me, want me to manage every other condition that they got going on, and I don't do that. I'm a surgeon, and so I surgically treat these diseases. I don't manage high blood pressure. I don't manage some of these other things. I don't manage a lot of these other sort of conditions that I may be able to explain it to them in a way that they understand. And we learned that with COVID. You got to break it down to people in a manner in which they can. And so regardless of, their background, I really got to use whatever I can. And oftentimes using analogies or using your own life experiences to do that is key, especially when I'm dealing with my active duty personnel. When I'm dealing with my vets, my former military, I can use some of that military language, that lingo, some of that vernacular to get them to understand. And so in certain ways that helps. But if you can't break it down to a third grade level, oftentimes you may need to wonder if how strong you truly know the material. And that's when I feel like you really have a mastery of the material, when you can explain it on a third grade level.
Thank you.
We do. Oh, sorry.
Oh, no, go ahead, Sid.
We do see two more questions in the chat from Stefan and Fania. If you want to go ahead and read them out loud, or.
Oh yeah. So how do you keep the strength to do what you do every day? You mentioned that you don't see me on a good day. How do you manage the weight of your responsibility and keep going? It is inspiring to see someone who is able to keep getting up and helping people. It's really understanding my why. First and foremost, it's my family, it's my kids. It's my faith. My faith, my family, and my patients. And it's tough, but I mean, I truly believe that, God created me to do just this. And I feel so blessed and fortunate that every moment, every aspect of my career has been, I feel like ordained by God. And the reason I say that is because I love playing video games, and, I literally play PlayStation to warm up for robotic surgery. And to sit up here and to tell me that, I make the type of living that I do doing that is just like crazy. And so, as far as people don't see me on a good day, I try to, understanding that it's someone's worst day when they see me, I try to be as empathetic as possible and not take it personal. Like, when they may be upset that they see me. And oftentimes most patients, when they do see me for the very first time, they're shocked. One, I look a lot younger than what I actually am. Two, I'm Black, and there's not that many Black, CT surgeons. And so the combination, I think there's a lot of things that when patients see me that, some of them are just, it can be off-putting, that this young looking person is going to tell me that they're going to stop my heart and they're going to do what again? And so, with that being said, just really trying to, be humble, be, understanding where they are at in life. They're scared, patients are scared when you meet them. And so just help them walk through that. But again, having that foundation, that village, my family, my wife, she's not in medicine. And so that helps to be able to have that escape. And so the biggest thing to kind of get through the dark days is just understanding your why, having that passion, and then the village around you. And then this is a great question as far as I remember you mentioning that going through this path of going into surgery is even more difficult for women. How may this be, and do you have any pieces of advices to get through it, or piece of advice to get through it? Yeah, so the reason why my perspective, and this is my own personal perspective as a Black male in medicine, who has gone through medicine with with a host of women. When I was a general surgery resident at Oregon Health Science University, we were pretty cutting edge and innovative because 50% of our residents were women. And so it was an interesting sort of perspective, and it was a great perspective. And the reality of the situation is, oftentimes, during the prime time of our lives, those childbearing, ages, 20s to 30s, we're in the doldrums of residency, and oftentimes it is very difficult to plan when you're going to have children. And so I've seen it happen. I've seen hosts of residents and fellows do it, but it is more difficult. And I think that it would be naive of me to say that the path through surgery is the same for men and women. It's not. It's not. It's a lot more difficult for women because of I think we have to acknowledge women can do things that men can't do, and for that it is more difficult to have to kind of figure out having kids, when to have kids, if they do have kids, the schedules. And there are certain things about us as surgeons that we don't want to put off on other people. When my son passed away, I felt bad, to a certain extent, of having to change the call schedule. That's just something that is innate to us, to not want to put other work on other people. And so, I've seen some of my colleagues kind of go through that same thing, almost, loathing the fact that they're going to have to go out on maternity leave or something of that nature. And so I think it's just something to consider and be aware of. Again, there's a host of physicians and female surgeons that have done it. And so the advice that I have is talk to those individuals that have done it. The shoes of women in thoracic surgeon, women in cardiothoracic surgery have been walked before. That journey has been had. And I have some amazing colleagues that I've trained with, that I know, that are true, phenomenal and exemplary surgeons, regardless of them being women or not. They're just great surgeons. And so is not to say that you'll be any less of a surgeon because of that. If anything, I think that any of the studies will show that women surgeons, can actually be better in some regards because of those experiences. And so with that being said, I don't want, that shouldn't discourage anyone from doing it, but I'd be remiss if I didn't, give individuals my full, honest opinion as to my perspective and what I've seen. And I think both as a physician, as a parent, and as a mentor, I think that it's incumbent upon us to always, as a physician, as parents, as mentors, to kind of give individuals as much information as possible. Not to scare them, but just to let them know what the reality of the situation is, and have them do with that information what they will. And I think that that knowledge can be power to help people figure out what's the best thing for them.
Thank you for that great response. I think I can pretty much speak for everyone here when I say that, like, your words are really inspiring, and the way that you're being vulnerable with us is kind of giving us all also a hint into your why, and then I guess a glimpse into what our why could be for medicine. So thank you for that. On a more general note, I'm also going to write this out in chat after I ask. I feel like one of the common questions, especially since you also told me to touch upon this, is what are some ways that pre-meds or people interested in going into medicine or healthcare, what are some ways that they could get involved early on?
Yeah, great question. And so, I think that in addition to things like this, there's medical marvels, there's diverse medicine. There's groups that you can join, especially from a pre-med perspective, to really get the exposure. And so I think that's one of the things that I encourage folks to do. The second is, as we Siddharth and I, Sid and I had talked before the presentation, is a shadowing. And so when I was in high school, I had the opportunity, I was blessed with the opportunity to shadow my mother's primary care physician. And so, you know, this was an invaluable experience because I think it really set me on the path of helping me kind of figure out what I liked and what I didn't like. And I figured out that what I did not like was clinic. I didn't like sitting in the clinic talking to people all the time. Like for 5 days a week, that just didn't seem interesting to me. What did seem interesting was being in the operating room, actually doing some procedures, washing my hands, gowning and gloving, playing music. So I played music in the operating room. And so, you know, all those things, you know, really seem to be a lot more fun. The environment, the atmosphere is totally different. So I say all that to say that part of shadowing is really just getting that exposure. And it's simply, you know, and how do you shadow somebody? It's, you know, it's oftentimes as simple as it sounds. You know, really just finding that individual, that physician, that individuals that is walking the path or in that same field that you want to go into, and just asking them, how did they get there? Being prepared with your resume or CV such that when preparation meeting opportunity, you know, so that when you get the opportunity to meet that person that is walking that path or doing the thing that you want to do, you're prepared with your CV in hand to say, hey, my name is Sid. I'm a high school student looking to go into medicine. And, you know, I'm really interested in what it takes to be in a physician. Would you mind if I just spent some time shadowing you or just interviewing you? I think that's another opportunity to really open up that conversation. And what you really want to do at this time is try to give yourself as much exposure as possible. And that's what separates those of us that didn't have a doctor in the family versus those of us that had a doctor in the family. It's just really exposure. My children are on a path, you know, more advanced than what my path was because their father is a physician, and therefore some of those steps, you know, are more illuminated than what it was before. And so oftentimes, you know, what hurts individuals from getting into medicine is just ignorance. You just don't know what you don't know. And oftentimes it's simply just asking and trying and finding out who those right persons are to ask. As it relates to both as far as interesting pre-meds getting interested in the healthcare, I think Sid mentions some good ones. Being a medical assistant, just that is a good way to get into healthcare. EMT is another good way to get into healthcare. When I was in high school, I was a lifeguard. And so with that, I had to learn how to, you know, CPR, ACLS. So I think that's a good way to do it, any sort of healthcare related fields. And then as it relates into competitive residencies, like general surgery and fellowships. So that's a whole nother topic when we're talking about competitive residencies and fellowships. A lot of that is really got to be specific and determined, and you know, you really got to be focused about what programs you go to, what med schools you go to, what sort of residency programs you go to, and who you do research with. And so there's some nuances when it gets into the competitiveness of certain fields of what you need to do. But if you have an idea early on that you want to go into something competitive, the first thing that you need to do is find someone in that field and get hooked up with them so that they can show you the ropes and put you on that path. Because again, in medicine, there's hard work and dedication, but then there's just, you know, who you know. And who you know can make just as much of a difference than what you know. Because who you know, they can help, you know, get you connected to the right institution, the right group of people, set you on that right path rather than you spending your time and wills, you know, trying to figure it out for yourself. So that would be the thing that I would recommend for those competitive fellowships and residencies. Find out someone in that field as early as possible, get connected with them, and hitch your wagon to that person. Are there any stereotypes of what fields of surgery are harder, easier? If so, what are they? CT surgery is considered to be hard. Neurosurgery is considered to be hard. That's a 7-year fellowship to do neurosurgery. CT surgery is, you know, they have these integrated 6-year programs. I did the traditional 5+2, meaning 5 years of general surgery and then 2 years of CT surgery. Now they have an integrated 6-year program in which it's all 6 years of doing CT surgery. Pediatric surgery is competitive. Operating on kids is competitive. That's one of the more highly competitive fellowships in general surgery is pediatric surgery. There's not a whole lot of pediatric surgeons walking around, and there's a reason for it, but pediatric surgery is very competitive. So those are some of the top competitive sort of fields. Orthopedic surgery is pretty competitive to get into ortho out of med school. It's amazing the top of your when you're in med school, those individuals that are in the top of your class, they're more likely go into ortho because it's very competitive outside of from med school to get into ortho. Once you've gotten into your residency program of like general surgery, again, the difficult ones are CT, pediatrics, and then some of the more competitive ones just in general are neurosurgery, ENT, and orthopedic surgery.
With that, just respectful of Dr. Noble's time, I think we can go ahead and end there. Thank you everybody for coming. Thank you so much, Dr. Noble, for doing that incredibly insightful, inspirational presentation today. I also just wanted to say that Emiliano has put links to 2 Eventbrites in the chat. These will be for our next 2 upcoming events. And if you guys could go ahead, take a moment and register for those, that would be great. Another thing is that today's meet will actually count towards your community service hours. So all you have to do is just email our Medical Marvels email. And if you are already a member, we can go ahead and note your attendance. And Emiliano, is there anything left on your end that you'd like to say?
Yeah, so if you already emailed me about community service, then I already have you down. Don't worry. I'm just going to redirect you to the Medical Marvels email. And with that, I think we can close. Thank you so much, Dr. Noble, for being here and for agreeing to present. It was truly inspiring, and I hope we could see you sometime in the future.
Yes, indeed. I definitely enjoyed it. And again, feel free to always reach out. If you guys ever want me to come back, I'd be happy to. So thank you so much.
Thank you so much.
All right, have a great night, great week.
Bye-bye, everybody.
Bye, everyone.